We're going to be talking with Dr. Dan Richman. Dr. Richman, can you tell me a little bit about yourself, what you do here?
I'm a pain management specialist, anesthesiologist, and I've been working for close to 30 years here at Hospital for Special Surgery, which is the preeminent orthopedic hospital in the country, specializing in orthopedic-related pain problems, spine problems, nerve pain problems, and I work full-time in this. This is what I do. I'm an anesthesiologist by trade, but also don't practice anesthesia anymore, just pain management.
Oh, and I guess one of the reasons we're here is I'm just curious as to how you came about working with Grandmaster Ren and learning about Tai Chi. Did you have an interest in martial arts before, or Tai Chi before?
Yeah, I never had any interest in martial arts. I knew nothing about them, and they didn't interest me. My exposure to, I always exercised. I loved to run. A little bit of weightlifting. Played basketball. Loved playing sports. As I got older and realized I couldn't play competitive sports anymore at the level that I was used to, I started just exercising at the gym, but it was mindless activity that, got my day going. And I ski, and I started windsurfing in the mid-90s. And suddenly one morning I woke up with pain on the right side of my neck going into my shoulder. And I was a little upset at myself, one, because I didn't know how it happened, and two, because how could I be one of my patients?
Right.
So I said, and I knew what it was. And I was in agony one day, and I didn't know what to do, and I put on a cervical collar, and I came to work. And one of my patients, I was about to do an injection on him. He looked at me and says, "I'm not going to have you inject me if you have a collar on your neck." And it so happens that patient was one of Master Ren's students. And he said to me, "You should try Tai Chi." And that was the beginning of it. Now, it just so happens that about a month or two before that, my brother, who had just started working with Lou Reed in helping him get his internet presence going, had taken me to a concert of his at Carnegie Hall, where I had seen Master Ren perform on stage. And I didn't know what it was. I'd never seen Tai Chi before. Mm-hmm. But I asked that patient of mine, I said, "Is that the teacher that you had, Master Ren, who works with Lou?" He said, "That's my teacher." He said, I don't remember whether Lou introduced him to Master Ren or vice versa, but they had that connection. And that was the beginning. And I went on a windsurf trip to Aruba, and my pain got particularly bad during that trip. And when I came back, I told my wife, I said, "I'm going to start doing Tai Chi." I said, "It's time I try this." And I went to the first day of class, and I was intrigued. I didn't understand it, but I was patient and willing to proceed with it.
And what were the results?
Well, initially not much, because I didn't know what to do, where to put my hands. I was in class with 20 or 30 other people. It was busy. It was Sunday morning. I got a little bit of attention from Master Ren. But I, plowed forward, and eventually I started noticing some relief. About, I would say, 2 months into it, I started noticing a little bit benefit. In fact, I was visiting a friend of mine in Pittsburgh who's a neurosurgeon, and I was doing Tai Chi in his backyard, but I was visiting him to see his partner to discuss a disc replacement in my neck. I was going to have a big operation. And at that point, I was taking pain medication almost every day. Nothing strong, but requiring it every day. I started doing Tai Chi in his backyard, and the pain diminished. And he looked at me and said, "Well, I'm going to introduce you to my partner to discuss the surgery, but really we're just going to go out for a drink. You don't need to have this surgery."
Wow.
He said, "If that helps you, you don't need this surgery." And that was only 2 months into it. But it was inconsistent, and I really didn't know what I was doing. And then I think about 6 months into it, Master Ren said, "Would you like to try private lessons?" And that's the beginning of the real relief and power and understanding of what it could do for my pain. So, of course, I had to recommend it to my patients soon after.
So you do recommend Tai Chi to certain patients?
Yes, ones that I think can put the time and energy into it.
Mm-hmm.
Once they are convinced that it's not a passive type of treatment, that they have to work hard at it, and if they're willing to do that, almost all of them have gotten some relief, some benefit, if they keep up with it.
Are there any particular types of pain relief they get versus other types that you have encountered?
Well, I mostly recommend it to patients with neck and low back pain.
Mm-hmm.
And some with arthritis, but not so much, because it can be very painful to do some of the deeper forms if you have arthritis in your ankles or your knees. So it's mostly for people with back problems.
What do you think of the silk reeling exercises? Do they have any benefits, do you believe?
Well, I can speak personally that I couldn't imagine doing anything after the silk reeling without doing the silk reeling first. It's an important warm-up exercise. It's an important way of adjusting your energy, yin, yang, and I've had patients who have studied with Ren who've never gotten even past silk reeling because it's so beneficial.
Mm-hmm.
And they're not interested. They have no interest in martial arts. They don't want to do any kicks or punches. And I get that. And that's the beauty of Ren's Tai Chi. It's so flexible. It's not just a martial arts exercise. It's stretching, it's relaxation, but it's more of an energy thing. And it's not easy to understand, but there are some who think in the pain management world that if you exercise your muscles in specific ways, particularly in the legs, for balance and power, that it releases an endogenous chemical that gives you pain relief. And we don't know for sure, but that's something that I'm going to be interested in studying, and I'm wondering if that's what is the effect of Tai Chi.
Interesting.
Yeah.
Have you found any benefits to standing mountain, meditation, things of that nature?
Well, I used to meditate when I was in college, and I don't really do meditation anymore. When I'm doing standing mountain, it's part of the beginning of silk reeling for me. So I do standing mountain every morning for at least 5 to 10 minutes until I feel enough pain in my thighs, beads of sweat across the brow, then I know I've done enough standing mountain. But it's an incredible exercise to relax the mind, relax the shoulders, relax the neck, and make the legs strong.
I've heard Master Ren refer to it sometimes when you're getting into the right posture and the right alignment as a Tai Chi vacation.
Yes. Yes. Well, it is. It's as Ren puts it, Master Ren often says, let your body feel it, feel the good that you're bringing to yourself in your body. Mm-hmm. I'm sure there's better words in Mandarin to explain that. But I'm fascinated by his understanding of the human body and energy, and I believe it's his training as a martial artist to be able to look at somebody and see their strong points and their weak points, and he uses that in a therapeutic way with Tai Chi.
So he is his technique is, how would you describe his teaching technique or his approach to the student?
I'm 60 years old. I've taken guitar lessons a lot of my life. I've taken ski lessons. I've done this. I've worked under doctors as mentors, and I've never had a teacher in anything that's as engaged as Master Ren is in the success of what he does. In fact, I've sent him patients who certainly have the wherewithal to take Tai Chi lessons privately, but their heart isn't in it. And he fires them, or he stops it if they're not, if we call the Shen, if they don't put their whole heart and soul into it. That's so important. And I think he can tell whether you're practicing or not. He can tell whether you're truly engaged. And his enthusiasm for Tai Chi is so infectious. I mean, you can see it in his class. You can see it with his other private students. It's not such a private club like some like secret club. It's everybody can do it. Anybody can do it. He can teach it to anybody. So I as a teacher, he's, I think, one of the best teachers I've ever had. And one of my doctor colleagues who goes to him at my request also says the same thing. So he's look, Lou Reed took lessons with him every day. If I could, I would too.
Yeah.
So
It's
I think
amazing.
that explains that.
Sure. So if you were to have a patient that comes to you with a neck pain or whatever, how do you explain the reason for you referring him not to another doctor but to a Tai Chi teacher?
Good question. I usually can manage all neck pain short of surgery. I'm not going to do surgery, but I can, do any kind of injection, recommend any kind of therapy, chiropractic treatment, physical therapy. And those are all fine when you're in acute pain and you need to get out of that really bad place. But once you're out of it and you want to prevent it from happening again, what are you going to do? How are you going to change your life? Or as Ren put it, how are you going to change your energy? And I think that what I say to patients is, look, once you get out of that acute stage and you're up and around, you're not going to go back to the same activity that landed you in my office in the first place. You've got to make changes in your life, in your body habits, in your posture, in how you do things. If you want to play golf, let's go over your swing, let's go over your form. Tai Chi is the perfect way to do that. So what I tell patients is that what I'm going to recommend to you is a whole body exercise. It's not Pilates. It's not, we don't isolate specific areas of the body. This is a total body exercise. And I always say to them, please suspend your disbelief and give it time to go forward. And if they do that, almost all of them never come back to me for injections.
Wow.
Yeah, very powerful. I mean, I'm not going to name any patients, but I'm sure you may interview them for this. So, and, we're friends socially, but they don't come to me for injections anymore. And if they do, it's rare. It's a rare event. So that's how powerful it is.
So what would you say to people that aren't patients and don't come to you for pain, but what would you say to them if they would ask what is this Tai Chi stuff? What do I need this for? Why would I do it?
Yeah, it's not as easy a sell as yoga, I have to tell you, and I don't recommend yoga to anybody because yoga brings me more patients than anything else. People twisting in the wrong way, if they don't do it the right way. The thing about Tai Chi is you can't do it the wrong way. If you're doing it the right way, which means you're not going to hurt yourself. Which to me, it's so inherently safer for people with particularly lower back problems. And so I say that right there should be enough to get you into it. But because it's a martial art, and most people don't have an interest in martial arts, they're shied away from it. But then I explained to them, I say, yoga was originally martial art. It's morphed itself into what it is now. So I say that, this is the kind of exercise that gives you strong legs, and I always tell them the same thing, is if you have more balance on one leg than most people have on two, then your spine is going to be fine. Because whatever it takes to get there is good for your spine. And but you know, in this culture that we live in, where people like to do Pilates or like to go to the gym and lift weights, and there's a certain mystique about that, they want to do that. I'm trying to move that over to Tai Chi. That's my life goal, actually, as a doctor.
That's great.
Yeah.
That's great.
So, I mean, because I just think those other exercises are fine, but they're going to cause more injuries than help. Whereas this, you'll get exercise, you'll have fun, you'll get a workout, and you'll be doing something good for your pain.